Hi everyone, Dr. Nemechek here. I want to touch on inflammation and cancer and how it negatively affects cancer in multiple ways. One is just first and foremost, I'm constantly talking about this chronic inflammatory problem that we have throughout the population. It's being fueled by gut bacteria, vegetable oils, these 2.5 micron particles that you get from automobile dust, or now they're reporting the kitchen range, stove, actually microplastics and other things that are making their way into our bodies. And it's believed that about 85% of cancers are actually triggered by the inflammation. And they're triggered either in that the inflammation itself is causing a mutation, and that is in and of itself cancerous, or we know that almost all of us have some form of cancer in us that's kind of due to what I call a typo, just so many cells dividing, but we have part of our immune system will just control that and they'll never bother us. So this is felt to be quite common. And if your immune system is working right, these cancers never become of anything your entire life. But if you have chronic inflammation, that kind of surveillance and control of these aberrant cells breaks down and cancer's formed. And they believe it's about 85% of all cancers would occur or are occurring because of inflammation. And these are mainly the cancers okay? Brain cancer, lung cancer, colon cancer, skin cancer, uterine cancer, ovarian cancer, and it's a big problem. And we even have an increasing incidence now of lung cancer in non-smoking individuals, predominantly women. And right now it's predominantly in women in their 40s. It's almost like a mini epidemic of lung cancer. Now, you get cancer, unfortunately. How does inflammation affect you? Well, the more inflammatory stress you have, the more aggressive the tumor is. All sorts of work discussing this to such a degree that some particular cancers are, the treatment for the cancer is improved if you use some of these inflammatory cytokine blocking drugs like they use for, like, say, rheumatoid arthritis. Now, it won't be the same one, but it's the same principle. So they actually will treat inflammation to help the chemotherapy. It actually reduces the aggression of the tumor, and it helps the drugs work better by reducing inflammation. So first off, try not to get inflammation. How? Keep the gut balanced. Olive oil, fish oil. Just at my work, if you think you have a vagal nerve failure, you need a vagal nerve stimulator, 5-10 minutes a day can dramatically reduce your inflammation. Try to limit sources of microplastics. Seafood is a big one. Sea salt is a horrible one. Sea salt is just full of microplastics that are inflammatory, okay? And, I'm even, about a sensor, I'm even checking the 2.5 micron particles in my kitchen to see if my range actually is releasing a dangerous amount of any of these compounds. And so you got to do things to try to prevent it by keeping your inflammation low. Generally, we don't believe that somebody will have colon cancer or breast cancer if their inflammatory levels in their body are normal, okay? And then if you are unfortunate to have cancer and are getting treatment, you need to still pursue a anti-inflammatory regimen to try to help support and make your treatment more effective. So there's a whole lot of work on this in the research world. People will say, well, why doesn't the oncologist talk about this? And generally, they don't think there's a whole lot they can do unless there's a drug in these certain conditions. They follow these guidelines, but otherwise, they They don't even want to dabble with fish oil and stuff like that. It's quite clear in the literature. They know it. They just don't know what to offer you, really. So anyhow, hope that's a little helpful. Another motivator to keep focused on inflammation, trying to keep your levels down. Take care now. Bye.